Cancer is a word that carries immense weight, touching countless lives across the globe. It begins when cells in the body start to grow out of control, forming masses called tumors. These abnormal cells can then invade surrounding tissues and, in some cases, spread to other parts of the body. This process, known as metastasis, is what makes the disease so dangerous and difficult to treat. For generations, a cancer diagnosis has been one of the most feared prospects in medicine, representing a complex and often unpredictable battle for patients, their families, and the healthcare professionals dedicated to their care. The emotional and physical toll it takes is profound. The impact of this disease is not limited to a specific region or demographic. It is a universal human challenge. Millions of new cases are diagnosed worldwide each year, making it a leading cause of death and a significant public health crisis. The reasons for its development are varied and complex, ranging from genetic predispositions inherited from our parents to environmental factors and lifestyle choices. This complexity is precisely why finding a single cure has been so elusive. Every person's cancer is unique, with its own genetic makeup and characteristics, requiring a dedicated and often multifaceted approach to treatment and management. For decades, the primary weapons against cancer have been surgery, radiation, and chemotherapy. While these methods have saved countless lives and remain crucial tools, they often come with significant side effects. Chemotherapy, for example, is designed to kill rapidly dividing cells, but it cannot always distinguish between cancerous cells and healthy ones, such as those in our hair follicles or digestive tract. This collateral damage leads to the familiar side effects of hair loss and nausea. The search for more precise, less harmful treatments has been the driving force behind modern cancer research, pushing scientists to find better ways to fight this formidable adversary. This relentless pursuit of knowledge is now bearing incredible fruit. We are living in a truly remarkable era of medical discovery, where our understanding of cancer at a molecular level is growing exponentially. Scientists and doctors around the world, like the esteemed Dr. Dahal, are working tirelessly to translate these complex scientific insights into tangible hope for patients. They are not just looking for ways to manage the disease, but are pioneering entirely new strategies to detect it earlier, treat it more effectively, and ultimately transform the future for everyone affected by it. This is, honestly, a story of progress, resilience, and unwavering optimism. One of the most powerful strategies in the fight against cancer is not a new drug, but rather the ability to find the disease at its earliest, most treatable stages. Historically, detection often occurred only after a patient began experiencing symptoms, by which time the cancer may have already grown and spread. Today, however, we are witnessing a revolution in early detection technologies that can spot cancer long before it becomes a visible or symptomatic problem. These new tools are designed to find the faintest signals of disease, giving doctors and patients a critical head start in what is often a race against time. A groundbreaking development in this area is the liquid biopsy. This is a simple blood test that can detect tiny fragments of DNA and other molecules shed by cancer cells into the bloodstream. Think of it like a detective searching for clues at a crime scene. By analyzing a patient's blood, doctors can potentially identify the presence of cancer somewhere in the body, sometimes even determining its type and origin. This non-invasive method is much easier for patients than a traditional tissue biopsy, which requires a surgical procedure, and it holds the promise of becoming a routine screening tool in the near future for many different types of cancers. Beyond blood tests, advanced imaging technologies are also playing a crucial role. Techniques like high-resolution MRI and PET scans are becoming more powerful and precise, allowing radiologists to see smaller tumors with greater clarity than ever before. Furthermore, scientists are integrating artificial intelligence into the process. AI algorithms can be trained to analyze thousands of medical images, learning to spot subtle patterns and anomalies that might be missed by the human eye. This doesn't replace the expert radiologist, but instead acts as a powerful assistant, enhancing their ability to make an accurate and early diagnosis. The ultimate goal of these innovations is to shift the paradigm of cancer care from reactive to proactive. Imagine a future where a routine checkup includes a simple blood test that can screen for dozens of cancers at once. If something is detected, highly precise imaging can pinpoint its location, leading to swift and effective treatment. This proactive approach could dramatically improve survival rates and reduce the need for aggressive, late-stage interventions. By finding the enemy when it is small and weak, we give ourselves the best possible chance of achieving a complete and lasting victory over the disease. For years, we fought cancer as an outside invader, attacking it with external forces like radiation and chemicals. But one of the most exciting breakthroughs has come from a radical new perspective. What if we could teach our own bodies to fight the disease? This is the central idea behind immunotherapy, a revolutionary approach that harnesses the power of the patient's own immune system to recognize and destroy cancer cells. Our immune system is a natural-born killer of abnormal cells, but cancer is clever and often develops ways to hide from it, effectively putting on an invisibility cloak. Immunotherapy treatments are designed to rip off that cloak. One of the most successful types is called checkpoint inhibitors. Your immune system has natural checkpoints or brakes to prevent it from attacking healthy cells too aggressively. Some cancer cells have learned to exploit these checkpoints, tricking the immune system into leaving them alone. Checkpoint inhibitor drugs block this interaction, essentially releasing the brakes on the immune system and allowing its powerful T cells to see and attack the cancer. This approach has led to remarkable, long-lasting remissions in patients with cancers that were once considered untreatable, like advanced melanoma and lung cancer. Another powerful form of immunotherapy is CAR T-cell therapy, which can be described as a living drug. In this highly personalized treatment, doctors remove a patient's T cells from their blood. These cells are then taken to a lab and genetically engineered to produce special receptors on their surface, called chimeric antigen receptors, or CARs. These new receptors are specifically designed to recognize and latch onto a particular protein on the patient's cancer cells. The millions of newly supercharged CAR T cells are then infused back into the patient, where they multiply and begin a targeted, relentless hunt for cancer throughout the body. The success of these immunotherapies represents a monumental shift in oncology. We are no longer just poisoning the cancer. We are empowering the body's natural defenses to do the job they were designed for. While these therapies are not yet effective for everyone and can have their own unique side effects, the progress is undeniable. Researchers like Dr. Dahal and his colleagues are continuously working to refine these treatments, expand their use to more types of cancer, and better understand who is most likely to benefit. This approach has added a powerful and life-saving pillar to our cancer-fighting arsenal. The future of cancer treatment is not about finding a single magic bullet, but about creating millions of them, each one tailored to a specific patient. This is the promise of personalized or precision medicine. We now understand that two people with the same type of cancer, such as lung cancer, might have tumors with vastly different genetic mutations driving their growth. Giving both patients the same standard chemotherapy would be like using the same key for two different locks. It might work for one, but not the other. Personalized medicine is about finding the exact key for each individual lock. This tailored approach begins with comprehensive genetic sequencing of a patient's tumor. By mapping out the cancer's unique DNA, doctors can identify the specific mutations that are fueling its growth. This genetic blueprint provides a roadmap for treatment, allowing oncologists to select targeted therapy drugs that are specifically designed to block the function of those mutated proteins. These drugs are often more effective and have fewer side effects than traditional chemotherapy because they zero in on the cancer cells while largely sparing the healthy ones. It is a smarter, more precise way to fight the disease. This revolution extends beyond treatment to prevention and risk assessment. As our understanding of the human genome grows, we can better identify individuals who have inherited genetic mutations, such as BRCA1 and BRCA2, that put them at a higher risk for developing certain cancers. This knowledge is empowering. It allows people to make informed decisions about their health, such as opting for more frequent screenings or taking preventative measures to reduce their risk. This proactive stance is crucial in our mission, to not only treat cancer, but to prevent it from ever taking hold in the first place. As we stand here on August 7th, 2025, we are at a profound inflection point. The breakthroughs in early detection, the power of immunotherapy, and the precision of personalized medicine are converging to rewrite the story of cancer. The work of brilliant minds like Dr. Dahal is transforming what was once a story of fear into one of hope and survivorship. The journey is far from over, but the path forward is clearer than ever. We are moving toward a future where cancer is not a death sentence, but a manageable condition, and ultimately, a disease that more and more people will survive and thrive beyond.